Are you out of breath? It could be something more than you think. Chronic obstructive pulmonary disease, or as you may have heard, COPD. It affects approximately 30 million Americans, and half of them don't even realize their symptoms. Here to help us identify the warning signs of this is nurse practitioner Mary Nera. She is with Healthcare Partners at DaVita Medical Group. It's great having you.
Hi, thank you.
So COPD, I see this whenever I'm watching the cable news networks. I always see a commercial, do you have COPD? And I'm like, I don't know. What is COPD?
So COPD stands for Chronic Obstructive Pulmonary Disease. Okay. And that's sort of more of a catch-all term for a number of chronic lung diseases, the most common of which are emphysema and chronic bronchitis.
Okay. In addition, obviously, shortness of breath, one of the big key signs that you may have COPD, but what beyond that, notable signs or symptoms that we could be on the lookout for?
So shortness of breath is definitely pretty much a very common symptom with that, but you could also be experiencing things like wheezing or a chronic cough with or without phlegm production, fatigue, inability to go through your function day to day because of shortness of breath or feeling short of breath with activities.
Is there a test to see whether or not you have COPD?
So the diagnosis of COPD is actually a lot of history taking. COPD is generally caused by chronic exposure to inhaled chemicals or pollutants, or most commonly cigarette smoke.
Of course, yeah.
And it leads to developing these illnesses usually later on in life. In order to diagnose it, we take a very thorough history of your smoking history, your occupational or environmental exposures, as well as your symptoms. And then we usually do some tests, the most common of which is a lung function test called a spirometry.
Is this the one
measures lung volume?
That has the thing and you're just able to like breathe in, breathe out? Yes.
Yes, and they tell you blow, 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 blow. Yes. And it kind of measures how air is going in and out of your lungs, and it tells us how your lung function is, and we use that to diagnose COPD, as well as sometimes doing other tests to eliminate other causes of shortness of breath, or like imaging that will help us confirm the diagnosis.
Is this something where if you catch it early, you can improve your ability to live going down the line?
Yes.
Okay.
Absolutely. The earlier we treat it, the better the results are, and there's also significant education and things you can do with lifestyle that will make you healthier in the long term if you catch this symptom and catch this problem early.
Absolutely. Tell us more about Healthcare Partners and what you're doing over there.
So Healthcare Partners is an independent medical group in Las Vegas, lots of different clinics, actually several specialties, and we use what's called a total care model. And so this model helps us have additional support for patients that have chronic illnesses like COPD. Absolutely.
We have a picture of this. It kind of explains the total care model. Best way to put it is, you know, you go to your regular doctor and then he sends you off to another person who has no idea who you are. You have to do 5 pages worth of charts or, you know, hi, my name is this, and then have to write the exact same thing in the next 5 pages as well.
Right.
You don't necessarily have to do that with Healthcare Partners because everyone within the network is all in the same game plan.
Yes, there's avenues for communication, and we have a lot of support people on our team, like care managers, RNs, LPNs, social workers. There's a whole concerted effort and team around keeping our patients healthy.
Absolutely. You also have a special needs plan. Explain this.
So special needs is basically a group of Medicare Advantage benefits that are available for people that have chronic illnesses, chronic serious illnesses like COPD, and you're able to qualify and sign on for these plans any time in the year.
So this isn't just only during open enrollment, which we hear a lot about. So when you enter into a special needs category, that opens you up to be able to reach.
Yes.
Excellent.
And so patients or people in the community can go to our website or one of our community events to learn more about that.
Speaking of, you have an event this Thursday.
I do.
Yes, you do. We're going to put up the screen. She's like, we do. There's so many events that you never know when one's popping up. But we have the full screen right now. It's this Thursday at noon over at Summerlin Library. And you can RSVP enroll with Medicare.com. The information is right there. If somebody's been diagnosed with a chronic condition, they want to learn more about Medicare Advantage, the whole system can be difficult to traverse, confusing.
Very.
There's a lot. Medicare plan this and that, and what is this? What's Advantage? I don't know.
Very.
Where do they go for more information?
So they can go to our website or any of the resources that I believe you're about to show on the screen.
Absolutely. We have it right there. Enroll with Medicare.com. You could also follow them on Twitter for more information. It's really powerful information. It's great having you.
Thank you very much.
Thank you. It's a pleasure. If you have more information, or you want more information rather, on COPD and other questions, you can contact Healthcare Partners Nevada, a DaVita Medical Group. Do so by heading to that website, enrollwithmedicare.com. They're a proud sponsor of the Morning Club. They're also on Facebook and Twitter. Stay with us. We'll be